If you're a parent of a little one, chances are you've heard those three letters, RSV, and they probably came with a little bit of a worried tone. It's one of the most common viruses out there, but let's be honest, for parents, it can also be one of the most stressful.
And that's the big question, isn't it? The one that keeps us up at night. You see the runny nose, you hear that little cough, and your mind just starts racing. Is this just a simple cold we can handle with tissues and cuddles, or are we on the edge of something more serious? It's a totally fair question because with RSV, that line can get blurry fast.
Now, here's the thing about RSV. This isn't some rare virus we're talking about. It is incredibly common. So common, in fact, that pretty much every single kid, we're talking nearly 100%, will get RSV by the time they're 2 years old. So really, it's not a matter of if your child gets it. It's about knowing what to do when they do.
Okay, so to really get our arms around this, we're going to break it down. First up, in Act 1, we're diving into the problem itself. What exactly is this virus, and how in the world does it get everywhere?
So the fancy name is Respiratory Syncytial Virus, but you can just call it RSV. And it does exactly what its name suggests. It targets the respiratory system, the lungs, and all those tiny breathing passages. Now, for most of us, it feels like a nasty cold. But for infants and toddlers, it can be a whole different story, sometimes leading to more serious stuff like bronchiolitis, which is when those tiny airways get inflamed, or even pneumonia.
And you can see right here just how sneaky this virus is. It's a master at spreading. It travels in little droplets when someone coughs or sneezes, and, get this, it can live on surfaces for hours. Just think about it. A toy at daycare, the handle of a shopping cart, a doorknob at home. A child touches it, and then they rub their eyes or put their hands in their mouth. And that's it. The virus is in.
All right, now we know what RSV is and how it gets around. Let's move on to Act 2, the journey. What does this illness actually look like day to day? Knowing what to expect can really help manage your own stress, not just your child's symptoms.
Think of this timeline as your roadmap. The first couple of days, it's probably going to look just like any other cold. But the part you really want to keep an eye on is that window from day 3 to day 5. That's when the illness often peaks. It's when all that mucus and inflammation can be at its worst and when breathing can get tougher. After that peak, things usually start looking up, but don't be surprised if that cough decides to hang around for a week or two.
This right here is probably the most important slide. Knowing the difference between my kid is sick and my kid is in trouble is absolutely crucial. On the left, you've got your standard cold symptoms, the stuff you can manage at home. But that column on the right, that's your action list. If you hear wheezing, see them breathing really fast, or notice chest retractions, that's when you can literally see the skin pulling in around their ribs with each breath. That means they're working way too hard to breathe. And if you ever see a bluish tint around their mouth or on their fingernails, that's a sign to get medical help right away.
Now, while any kid can get RSV, some are definitely more vulnerable to a serious case. Age is the #1 factor. Little infants, especially those under 6 months, are most at risk simply because their airways are just so tiny. And then if you add in other factors like being born premature or having an underlying heart or lung condition, the risk of needing hospital care goes up quite a bit.
Okay, deep breath. Let's get to the most important part, the parent's playbook. This is all about what you can do right now to help your child feel better and protect your family. We're talking supportive care and smart prevention.
For a mild case that you're managing at home, your main job is comfort, and your two best friends are going to be suction and hydration. Use saline drops and one of those nose sucker bulbs to clear out all that gunk, especially before they eat or sleep. It makes a huge difference. And keep pushing fluids, milk, formula, whatever they'll take, to keep them hydrated and help thin out all that mucus. On top of that, let them rest, manage any fevers with your doctor's okay, and a cool mist humidifier can be really soothing for their little airways.
This is such a critical point. As parents, we want a magic pill to fix it, right? But with RSV, there isn't one. It's a virus, so antibiotics, they're totally useless. All the treatment, whether you're at home or in a hospital, is what we call supportive care. Basically, just helping the body do its job to fight off the infection on its own.
So, since we can't just knock it out with medicine, our best strategy is to try and avoid it in the first place. Let's talk about your first and best line of defense, prevention.
And look, none of this is rocket science, but it really works. Washing hands like it's your job is #1. Wiping down all those high-touch spots, toys, doorknobs, you name it, helps break that chain of transmission. And just being a little extra careful about keeping your baby away from anyone who's sick, especially during the fall and winter, can make all the difference.
If you only take away 2 things today, let it be these. Seriously, Washing your hands constantly and making sure your child is in a smoke-free environment are two of the most powerful, proven things you can do to protect them from getting a bad case of RSV. They are your shields.
So there you have it, the parent's playbook for RSV. Knowing what to look for is half the battle, but turning that knowledge into action is what really keeps your family safe. So as we head into cold and flu season, what's one small change you can make, starting today, to create a healthier space for your child?
Health is the most precious gift. If this video helped you or someone you love, please like, subscribe, and share so more families can stay safe and healthy.